All right, I think we're now live. So welcome everyone. My name is Leonardo Flores. This is our weekly webinar for Code Pink Latin America team called What WTF is Going On in Latin America and the Caribbean. I am very honored today to have as our guest Her Excellency Josefina Vidal, who was ambassador to Canada. And before we get started, I just really want to bring up the fact that last week in DC, the Cuban embassy here was attacked. It was fired upon by a man with an assault rifle. And I know we want to, on behalf of Code Pink, we would like to extend our full solidarity and support to Cuban diplomats all over the world. And we've written a letter to the police chief here in DC asking for a full and transparent investigation. Welcome to the webinar, Your Excellency. Thank you for being here with us. Let's just jump right into it. Can you give us an update on COVID-19 in Cuba?
Yes, Leonardo, thank you so much to you and Code Pink for organizing this live interview. And thank you so much for supporting our embassy in Washington in this very serious situation they faced a few days ago. And shamefully enough, so far, there hasn't been any high-level statement on behalf of the United States government in front of this very, very serious attack, terrorist attack that our embassy there suffered. So thank you so much for inviting me to share with friends of Cuba and all who are interested in Cuba information about how we are coping in our country with the pandemic, the COVID-19 pandemic. As soon as the first cases were detected in our country, Cuba mobilized all its resources, and they are limited, but based on the strength of our health system and with the support of the Cuban scientific community, we have been responding, I would say, quite well. And so far we have done a quite good job in order to protect our population and to try to contain the spread of COVID-19. As I said to you, so we based all our efforts on the strength of our health system, which is a universal health system with access to the whole population, and which is based mainly on prevention. So prevention has been a key factor in our fight against COVID. For example, at the primary level, family doctors, nurses, students of medicine are going door to door to see for possible symptoms of COVID. And as soon as people with symptoms are detected and they become suspect of having the disease, they are transferred to specific centers, where they begin receiving treatment in order to improve the response of each of the persons to the COVID. And as soon as there are cases who are tested positive, those persons are immediately hospitalized. And they begin receiving treatment with different medicines, the majority of them medicaments that have been developed by the Cuban pharmaceutical and biotech industry. And of course, the same applies to people who become seriously sick, to severe serious cases and critical cases, which begin receiving treatment with more medicaments. And I can tell you that now 19 medicaments that have been developed in Cuba are being used as part of the protocol treatment for patients with COVID. That has helped us so far to keep, I would say, low numbers, quite relative low numbers of people tested positive, low numbers of people who become seriously sick or critical, in critical conditions, and to keep a low numbers of people who have a dead of diseased people. So far, only 69, which makes that Cuba has a very low mortality rate when you compare us with the rest of the Americas and with the rest of the world. So far, it's around 4%. When you see that in other countries and in the world is around more than 5 or even 7%. Another important element is that for several days now, the number of recovered patients is bigger than the number of positive cases. And we already reached in Cuba the peak of the disease. That happened on April the 24th. And the projections so far, in case that we can keep the disease controlled, is favorable. But in any case, we cannot relax immediately the measures that has been imposed, applied in Cuba of physical distancing, isolation, and some sanitary measures that we are asking people to continue respecting in order to continue advancing in this favorable scenario that so far seems to be the case for the immediate future in Cuba.
That's great. It really sounds like Cuba's investments in biotechnology and its health center are really paying off in terms of being able to control this disease. And it's not just Cuba controlling the disease at home, it's also helping to stop the pandemic abroad. I think Cuban doctors are now working in over 20 countries against COVID-19. Can you give us a few details about how Cuba's showing solidarity to other countries during the pandemic?
Yes, Cuba has so far responded to requests for collaboration from more than 20 countries, mainly in Latin America and the Caribbean, but also from Europe, such as Italy and the Principality of Andorra, Africa and the Middle East. In just a few weeks since the pandemic became a challenge for all of us, Cuba has dispatched 25 contingents of the Henry Reeve Brigade to help 23 countries in the fight against COVID-19. This brigade, Henry Reeve Brigade, is highly specialized in intervening in situations of natural disasters and serious pandemics or epidemics. More brigades could be deployed in the future. This is something that I can share with you, taking into account that we have received requests from more than 50 countries now. This is about more than 2,000 Cuban doctors and nurses who are part of these Henry Reeve brigades in 25 countries. And they have added to the more than 28,000 Cuban doctors, nurses, and health professionals that were already working in 59 countries before the pandemic. So this is like a reinforcement in some of the cases. And in other cases, Cuban doctors and nurses who were already in place working are being trained in order to help local health authorities coping with the pandemic. And for example, in the last few weeks, different video conferences have been organized between the Institute of Tropical Medicine in Cuba with Cuban brigades, the others, not the Henry Reeve, but the others who were already in place, working in different countries, to train them and share with them a specific information about treatment that can be applied to patients with COVID. And I have to add to that with several countries, we are sharing also some of the medicines, the medicaments that have been developed by the Cuban biotech and pharmaceutical industry, which are being used in our protocol of treatment for patients with COVID. So we are sharing with some countries because we have received more than 70 requests for specific medicaments, and we are sharing these medicaments with other countries too. And of course, I have to say, because sometimes people ask about this, that we have undertaken all these actions without neglecting our duty to protect the Cuban population and to take care of the Cuban population.
Yeah, that's amazing. And a great example of solidarity. I'm from Venezuela, and I know that things would be very different today in Venezuela were it not for the great work being done by Cuban doctors and by the tons of supplies that Cuba sent to Venezuela just at the onset of the COVID outbreak there in early March. Um, can you talk, unfortunately, we talked a little bit about the Henry Reed Brigade, and unfortunately, Cuban doctors, and this brigade in particular, have come under increasing attack by the Trump administration here in the United States. They've gone so far as to falsely accuse Cuba of human trafficking through its doctors program. Can you address these allegations and talk a little bit more about, what the Cuban doctor program means and how it's become, I think it might be fair to say, Cuba's primary export?
Yes, there is a long history and tradition of international solidarity of Cuba with other countries in the health sector. And that goes back to the early 60s, when we started sending small contingents and brigades at that time to help other countries. I remember helping some Latin American countries in situations of emergency situations created by earthquakes, but also, for example, helping Algeria, which had got recently its independence, and we sent doctors to help them to improve and even create and support their healthcare system. Since the 60s until now, more than 400,000 Cuban doctors and health professionals have provided services in 164 countries. And this collaboration has been of different kinds. In some cases, we have helped strengthen and improve the healthcare system of different countries. In others, we have provided services in remote areas where there are no doctors, or where no doctors would like to go to work. In other countries, we have trained their doctors, in some of them in those countries, but in the majority of the cases in Cuba. So we have a huge scholarship program for training foreign doctors in Cuba. Now it's mainly done at the Latin American School of Medicine. In other countries, we helped them create their own schools of medicine. And we have done that in several countries in Africa, specifically. And in other cases, as I said before, we have intervened in cases of emergencies as a result of natural disasters or very, very serious epidemics. And in 2005, based on this long experience, Cuba decided to create the Henry Reed Brigade, which is, as I said before, is highly specialized to intervene in situations of disasters and serious epidemics. Since that moment, since 2005, 7,000 doctors and nurses and other health specialists who are part of the Henry Reed Brigade have provided services in more than 20 countries. I can mention some important examples. In 2005, after the earthquake in Pakistan, 32 field hospitals with Cuban doctors and nurses were deployed in that country. A medical team was sent in 2006 to Indonesia after the tsunami that hit a significant part of that country. More than 1,700 members of the Henry Reed Brigade were dispatched to Haiti in 2010 after the earthquake. And they also a little bit later helped that country to cope with the cholera epidemic that they had. In 2014, which is most known by many people in the world, 3 Henry Reed Brigades were sent to Liberia, Guinea, and Sierra Leone in West Africa to combat Ebola. And they have helped more recently other countries in the region, for example, Mexico, Ecuador, Peru, Chile, and Venezuela in emergency situations. Actually, I have to tell you that one of these brigades, I would say the first Henry Reed Brigade after it was created, was ready to assist Louisiana after New Orleans was hit by the Katrina hurricane. But unfortunately, as you know, the United States government rejected our cooperation. So assisting others and sharing with other countries what Cuba has always been part of what we are as a country, but also part of the ethic in which Cuban doctors and health professionals are trained in Cuba. The Trump administration, going to the first point of your question, as part of the escalation of hostility against Cuba, has decided to attack our medical collaboration programs with other countries. Their purpose is they have the US government has a dual purpose. The first one is to discredit Cuba. This is which provides them pretexts in order to justify their very unfair, cruel, and universally condemned policy of blockade against Cuba. So to discredit Cuba is the first purpose. Cuba, which you know has earned a recognition internationally and prestige because of the work of its doctors in different countries, including, for example, the former President Obama's administration, which recognized and even cooperated with Cuba in the fight against Ebola in West Africa. And the second purpose of the US government, of the Trump administration, is to deprive Cuba of income in the cases in which the cooperation agreements with other countries include receiving legitimate monetary compensation for the services that Cuba provides. And in this case, I have to clarify the following. Cuba is a country with limited economic resources, which is being affected more and more because of the strengthening of the US blockade. Which is having a very significant negative impact on the Cuban economy. And there are countries in the world which have enough economic resources and lack doctors or health professionals and are ready to legitimately pay Cuba for the services that we provide. And in those cases, you know, there are specific agreements and specific contracts that voluntarily every Cuban doctor signs, and which states that doctors who go to one of those countries which is ready to pay Cuba for their services, that individual contract provides that Cuba will keep paying the full salary of the doctor in Cuba, and it goes to a bank account or to a family member, which is declared the beneficiary while the doctor is abroad providing its services. And that individual agreement says that a portion of the payment goes to the health system in Cuba, because Cuba has a universal health system, but that costs money. And so those incomes help Cuba buy very costly and expensive material, equipment, medicaments for the whole population of Cuba, for 11 million people, even for the families of the doctors who are providing their services abroad. And this income also helps Cuba buy, for example, raw materials that are very important to produce the majority of the medicaments that we make available at very low prices, subsidized by the government to the whole Cuban population. So it's a shame that the United States government is attacking our collaboration with other countries. They are using slanders and lies in order to support their accusations against Cuba. But you know, we even have information that in some cases the United States government, the current government, has used pressures and threats against other countries to force them to cancel and suspend the collaboration agreements in the health sector with Cuba. And in other cases, they have gone beyond that, even trying to pressure governments not to accept the collaboration that Cuba is offering to cope with the COVID pandemic, which is shameful. And you know, I have also one very personal opinion that they do that also to divert attention from the own inability of the United States privatized health system to protect its own population in the middle of this pandemic.
Yeah, I absolutely agree. And it's really goes to show the politicization of health, how the United States politicizes health. Going back to 2005, that was a great example of how Cuba, in the midst of a terrible disaster that befell New Orleans, Hurricane Katrina, they offered doctors and the Bush administration said no. And we're seeing similar politicization of health today. And it's really kind of amazing to me that Cuba bases its economy on health. And that's such a great contrast to draw between Cuba and the United States. Cuba bases its economy on health and exporting doctors and medications. The United States is an economy based on war that exports weapons and that exports military conflict, basically. But I'm also glad that you brought up the subject of international recognition for the Henry Reed Brigade, because we here at Code Pink, in coalition with several other Cuba Solidarity groups, and it's a growing coalition, have started a petition to the Nobel Prize Committee to award the Henry Reed Brigade the 2020 Nobel Peace Prize. For those of you who are watching and wish to learn more, please go to codepink.org/NobelCuba. I think it's really important not just to highlight the amazing work and solidarity shown by these Cuban doctors who are putting their own lives at risk to help others fight through this COVID-19 pandemic, but also to show solidarity and support for Cuba in the face of these attacks by the Trump administration. And so switching, actually, we just got a question from one of our viewers who wants to know about US citizens who have attended ELAM, the Latin American School of Medicine. And since you're the ambassador to Canada, if you could talk a bit about how this School of Medicine has, seen to the education of Americans and Canadians.
You know, I think it was in 1999. Actually, I was working at the then Cuban interest section in Washington when, at the request, of the Congressional Black Caucus in the US Congress, Cuba opened up the possibility for American students to go study medicine in Cuba and to join the thousands and thousands of students from all over the world who had been already studying medicine in Cuba for quite a few years already. And I remember how that process started. It was the Congressional Black Caucus as a result of a visit they paid to Cuba when they saw that marvelous school of medicine where foreigners from all over the planet were studying medicine that had the idea to include Americans from low-income families, young Americans who couldn't afford paying for studying medicine in Cuba. And so with the help of Reverend Lucius Walker and Pastor for Peace, that program was set up several years ago. I don't have the updated figure about how many young Americans have graduated from that school in Cuba. When I left Cuba 2 years ago to come to Canada, they were more than 100. And I know that the majority of them have been able to pass their exams in the United States, and many are working in community, centers, clinics, or are doing their specialization, which is very good, in different hospitals in the US. I have seen some of them in the last few days making statements or being interviewed or participating at webinars to share with others the experience of having studied in Cuba and what they have brought back to the US as part of the training that they have received in Cuba. Actually, I participated at a webinar in April, and there was one of those students graduated in Cuba. She's a doctor now. And tomorrow, if I can make this invitation and spread this through you, I know that at 7 p.m. tomorrow, Global Exchange is organizing a webinar with the participation of the Cuban ambassador to the US, Jose Cabañas, and one of the doctors who studied medicine in Cuba and is in the front line fighting COVID-19 in New York City, which is, you know, the epicenter of the disease in the United States. So this is what I can tell you.
That's great. I hope people will tune into that webinar as well. And, you know, I want to bring up another initiative that Code Pink is working on, and that's the new Good Neighbor policy, which kind of draws inspiration from a period in the United States when there was an attempt with mixed results to end the Monroe Doctrine and to reorient the relations between the United States and Latin America. Can you talk a little bit about in general terms about Cuba's foreign policy and the principles it is based on? Because for us, I mean, Cuba is such a great example of what a good neighbor should be in terms of relations, having helped fight and end apartheid, having, you know, such a long history of supporting poor people and of course in terms of health as well, as we've discussed.
The basic principles that have governed Cuban foreign policy since 1959, from the very beginning of the Cuban Revolution, are still there. So there is continuity in the principles that guide our foreign policy. And if I can summarize them, I would say that this is anti-imperialism is one very important principle in our performance in the international arena. The fight for a change in the structure of the multilateral system, specifically the democratization of the United Nations. This is something that Cuba has always promoted. Another very, very important principle is the prioritization of relations with the countries from the South and international solidarity. So no matter what has happened in our recent history, you will find every time in our performance, in our actions in the international arena, those principles. And collaboration, mainly what we call now South-South cooperation, is a central axis of our foreign policy, which is now in full display in what we are doing, trying to collaborate with other countries in the fight against the COVID-19 pandemic. But in general terms, I will say that Cuba's foreign policy is guided by the purposes and principles that are enshrined in the UN Charter and international law. You know, sovereign equality, the settlement of disputes through peaceful means, to refrain from the threat or the use of force, non-interference in the internal affairs of other countries, to promote cooperation in solving all the problems, international problems that we all face, and developing friendly relations with all the countries. You know, more recently, in 2014, the countries of Latin America and Caribbean decided to sign a proclamation of Latin America and the Caribbean as a zone of peace that was adopted in January 2014 by the heads of states and governments of the whole region, Latin America and the Caribbean. And in that document, which is very important, you find the principles and purposes of the UN Charter that I just summarized for you. But there are other commitments that we made and are very important for all countries of the region. And Cuba's foreign policy is guided also by those commitments. And for example, among them, to foster cooperation and friendly relations with other nations, irrespective of the differences that there might be between us, and irrespective of the differences that exist in the political, economic, social system of our different countries, to practice tolerance. This is another very important principle, and live together as good neighbors, to fully respect the inalienable right of every state to choose its political, economic, social, and cultural system, which is an essential condition to ensure peaceful coexistence and peace in our region. So in general, those are the principles that guide our foreign policy.
And this agreement you're referring to was with the CELAC, the Community of Latin American.
The CELAC. So it was at the summit of CELAC that took place in Havana in January 2014, when this very important document was signed by all governments of the region.
And it's such a great point that you mentioned that it explicitly called for maintaining relations between countries that have different ideologies, because that's something that today has fallen apart in Latin America. And we see a deep ideological divide. And even 6 years ago, there was cooperation between the right wing and left wing. And today that cooperation seems to be dying out. And that's very much the reason for that. It has to do very much with the Trump administration and what it's doing to drive wedges in Latin America. And so I want to talk a bit more about what the Trump administration is doing to Cuba. I mean, we talked a little earlier about the demonization of the doctors, but in addition to maintaining the 60-year blockade, Trump has imposed new sanctions on Cuba, and in what it's called what they're calling a maximum pressure campaign, which is exactly the same rhetoric being used against Venezuela and Iran and Nicaragua. So can you tell us a bit about how these new sanctions are affecting Cuba, and what the Cuban people and government are doing to overcome them?
The Trump administration has decided to dismantle the limited progress that we were able to make with the previous administration, the Obama administration, and has decided to replace a policy that was aimed at trying to normalize relations between Cuba and the United States with a policy that he has named strengthening US policy towards Cuba. One important component of the strengthening of US policy against Cuba has been the reinforcement of the US blockade. The US blockade that has lasted more than 60 years and has had all over those years a very significant negative impact on any single Cuban and on the functioning of Cuba as a country and our economy in general. Just between January 2019 and March 2020, so in a little bit more than 1 year, the Trump administration has implemented 90 measures against Cuba. I mean, blockade, economic measures, sanctions against Cuba, which have targeted the main sectors of the Cuban economy, specifically those who represent important incomes for our country. And for example, those specific targeted measures have affected Cuba's financial transactions, our tourism industry, the energy sector in our country, foreign investment, which is key for the development of the Cuban economy, and medical cooperation programs with other countries. Those sanctions, those unilateral coercive measures are unprecedented for the level of aggressiveness and for the scope they have. And they are deliberately trying to deprive Cuba of resources, of sources of revenue and income that we need for the development of the Cuban economy. As a result, for more than a year now, we are feeling more and more the impact and the effect of this reinforcement of the US blockade on the living conditions of the Cuban people and on the Cuban economy in general. And the effects of the blockade are felt even more now when Cuba is facing the COVID-19 pandemic. Why? Because the blockade is impeding, for example, Cuba to have access to much needed materials, equipment, and medicaments that we need in order to be able to face this pandemic. And for example, Cuba, because of the US blockade, doesn't have the possibility to buy equipment or technologies that are needed now, in which more than 10% of the components are American origin. There have been cases of restrictions imposed on banks, on airlines, on shipping companies by the United States, or pressures against them that have impeded Cuba to receive in time material that other countries are donated or sending to Cuba. And it was in the news a few weeks ago, for example, that the Alibaba Foundation of China decided to make a donation of masks, rapid diagnostic kits, and ventilators to Cuba. And those very important means were not able to reach our country because the airline, which was contracted by the Alibaba Foundation to transport those items to Cuba, rejected to do that, arguing that it was afraid of being sanctioned in some way by the United States because Cuba is a country under sanctions. More recently, a couple of weeks ago, a vessel arrived in Cuba with a cargo of raw material that was needed to produce medicaments in Cuba. And this vessel, this ship, decided not to unload the raw materials because the bank that was taking part in the transaction, and that was the one that we were using to send the payment for these raw materials, decided not to do that because of fear to be sanctioned by the United States government. So those are just a few examples of how the US blockade is affecting Cuba now when we are facing this important and challenging pandemic. And that's a reason why, and I agree with him, our ambassador to the US, Jose Cabañas, a few days ago said, very rightly so, that Cuba is facing now two pandemics. One is COVID-19, and the other one is the US blockade, which we have had to suffer for more than 60 years now.
Yeah, it's incredibly shameful that the Trump administration is tightening its strengthening its attacks on Cuba during this global pandemic. What we're seeing really, and they routinely claim that these sanctions or that sanctions in general have exemptions for humanitarian aid and food and medicine. But as we've seen in the cases you've just described, these exceptions do not work. Sanctions in the blockade are a blunt instrument. They're basically collective punishment of a people. And I was wondering what Canada's position is on the Trump administration's policy of strengthening the blockade. Are they confronting the Trump administration, or is it more silently not doing anything?
You know, Canada has traditionally supported and voted in favor of the resolution that every year Cuba presents at the UN General Assembly, asking for the end of the US of the blockade imposed by the US government against Cuba. So the Canadian government regularly, traditionally has voted in favor of that resolution, and they did the same last year in November 2019, when 187 countries supported Cuba's resolution against just the vote of three countries. Also, I can share with you that every year before Cuba presents its resolution to the UN General Assembly, the Secretary General of the United Nations addresses a note, a letter, to each member state to ask them to report to him how they have complied with the text of the resolution against the US blockade on Cuba. And I can say to you that Canada has been responding in the last few years, every year, the letter of the UN Secretary General. And for example, I have the text of Canada's response last year in front of me. And in this, its response, Canada said, for example, that it considers the extraterritorial application of unilateral Cuba-related measures to be contrary to international law, and that Canada was deeply disappointed with the decision by the United States government to activate Title III of Helms-Burton Act. And it even said that the embargo, as Canada calls the US blockade, has a negative impact on the living conditions of the Cuban people, but also on Canadians who are conducting legitimate trade and investment in Cuba. And with regard to Title III of Helms-Burton, which, as people know, is aimed at trying to discourage foreign investment in Cuba, the Canadian government issued at least 2 statements last year, firmly saying that it would apply its antidote legislation that exists in Canada against extraterritorial measures, and that it would defend Canadians and Canadian businesses conducting legitimate trade and investment in Cuba. So Canada has always been part of the universal condemnation and rejection of unilateral US sanctions against Cuba.
We've taken up a bunch of your time already, but we have one final question that came in from one of our viewers. And they're asking about the development of medicines in Cuba to fight COVID-19. If you could give a little more information.
Okay, that maybe we have to organize a webinar or an interview with Cuban scientists and experts and healthcare officials. I am not an expert, but I try to follow everything which is being done in Cuba. Actually, yesterday, there was a TV program in the afternoon with the participation of representatives of the scientific community in Cuba, those who have been developing for years several medicaments, vaccines, antibodies, molecules to treat different diseases in Cuba. It could be psoriasis, it could be cancer, it could be heart attacks. But those medicaments, some of them have shown that they can help in the case of patients with COVID-19. And there are several clinical trials undertaken now in Cuba. In some cases, they are applied with suspects of having the COVID-19 who receive these specific medicaments in order to try to see if they are effective in improving the response to the disease and to prevent those people from becoming seriously or critically ill. So there is a clinical trial underway. So far, it seems that the results are good, but you know, we have to give some time because there is a protocol, very strict protocol that has to be followed before you can assert and say to the scientific community, here is a medicament, here is a molecule, here is an interferon, or here is an antibody which is effective to prevent or to help patients with COVID. And in another case, there are other clinical trials which are being developed with patients who are critically or seriously ill. And again, at some point, we will have news about this. What I found interesting in the TV program yesterday They shared with the population that there is one specific medicament which is being used in senior homes, in homes for senior people. You know, they have been affected in a very, very severe way almost everywhere, in Canada, in the US, in Europe. And I was very glad yesterday to listen to our scientists saying that we have very low numbers of cases of people sick in senior homes, because it seems that the medicament that we are using as a preventive way in this specific vulnerable sector, you know, which is people, aged people, that they seem to be effective. I mean, this medicament seems to be effective. So I hope that sometime in the immediate future, or maybe early next year, we will have a lot of information and maybe articles coming out of the Cuban scientific community to share with the rest of the world what we have done and what has helped Cuba to keep the numbers low and to control and to contain this pandemic. But as I mentioned, there are 19. This is the last number I read about. There are 19 Cuban medicaments, or you know, developed in Cuba, which are being used now to treat COVID-19 pandemic in different stages.
Well, thank you so much for your time. I hope the viewers have
Welcome.
come away with a greater understanding of everything Cuba is facing during this crazy pandemic and during the escalation of Trump's attacks towards Cuba. We hope to speak with you again soon. And thank you again, Ambassador Josefina Vidal.
Thank you, Leonardo. Thank you for giving me the possibility to share with others what we are doing. And I want to personally thank you and express to Code Pink our appreciation for the petition that you mentioned, that you just launched in order to propose the Cuban Medical Brigades for the Nobel Peace Prize. I think they highly deserve this. So I wish all the best for you and all success in this campaign, which I am sure if we all help you, spreading the word will be supported by many, many people all over the world, and mainly in countries which are receiving directly the benefits of the services that those are very well trained and you know, selfless Cuban doctors are providing to them. Thank you so much.
Yes, absolutely. And if anyone's listening who belongs to an organization that works on Cuba Solidarity, this campaign is meant to be a coalition. So please contact us at Code Pink so you can sign on to this, because I really think we can, you know, shine a light on everything that Cuba is doing to fight this global pandemic. And it's a great opportunity for that. Thank you again, Ambassador. And I hope folks tune in next week for another episode of the WTF webinar.
Have a nice day. Stay safe and healthy.
You as well. Bye-bye.
Bye.